Emergency rooms across Quebec, especially in the Greater Montreal area, are under intense pressure. Occupancy rates have climbed well above capacity, with some hospitals nearing or even exceeding 200%. A post-holiday spike in influenza cases, combined with staff shortages and a lack of hospital beds, is leaving patients stuck on stretchers for hours and sometimes days. To help us understand what's driving this congestion and what it means for patients is Dr. Chris Labos, cardiologist with a degree in epidemiology. Dr. Labos, thank you for joining us.
Thank you for inviting me.
So, starting off, from your perspective, what's really behind this level of overcrowding?
Well, there's a combination of factors. One is increased demand, and the other is decreased supply. So we're seeing increased demand because we are having a pretty bad flu season, notwithstanding all the other respiratory viruses that are circulating, COVID, RSV, and all the other things that make people sick. Whenever you have snow or freezing rain, people fall, people injure themselves. So there's a lot of reasons why people go to the hospital, and there's always a peak in demand during the winter months because of the respiratory viruses. You couple that with decreased supply. We have less personnel than we once did. We have less resources. There's a shortage of hospital beds. So that creates a bit of a bottleneck. So you have more people going into the emergency room and fewer people coming out because you can't find beds for them in the other hospital departments.
Now, health authorities are urging people to avoid emergency rooms and call 811 when possible. But in your experience, in practical terms, who do you think should still be consulting the ER and who should be thinking twice about going?
It's a tough one because it is a bit of a judgment call. Writ large, you go to the emergency room if you're getting worse, not better, if you're struggling to breathe and need oxygen, or if you can't sort of keep down food or drink and you need to get intravenous fluid and hydration that way because you're at risk of becoming dehydrated. But it can be hard for most people to know. And so calling 811 is one good way to speak to a medical professional so that they can triage you and tell you, yeah, you probably should go to the emergency room, or you can go to this clinic, the following day if you're not feeling too bad. But it is that bit of a judgment call, which is a little bit hard for some people to always figure out.
And just lastly, if we can, we're hearing patients spending days, hours, long ends on stretchers. What kind of, this backlog, what does it mean in terms of patient care and quality care going forward?
Well, it's obviously not a good thing. I don't think this is desirable from anybody's point of view. It is a problem because when you have these types of backlogs, it's harder to keep track of patients. It's harder to treat patients properly. And in one sense, it's traffic because we know what's needed. We just need more resources to move people out of the emergency rooms, to get them hospital beds, to get them places in long-term care centers. But those things cost money. And until we pour in the resources to open up these extra beds, we do not have avenues to move people out of the emergency rooms. And that is what contributes to the backlog.
Dr. Labos, thank you for your time.
Thank you.